Before we begin, a brief note for listeners. This episode includes discussion of suicide. Listener discretion is advised.
You're listening to the Chemical Sensitivity Podcast. I'm the host and podcast creator, Aaron Goodman. Many listeners of this podcast trace the beginning of their experiences with multiple chemical sensitivity, MCS, to a series of specific exposures or a one-time exposure, often to pesticides, fragrance products, mold, smoke or fumes, and more. And many others report something different. They say their symptoms began after taking a prescription medication, especially antibiotics. One group of antibiotics in particular, fluoroquinolones, has been linked to a condition known as Fluoroquinolone-Associated Disability, or FQAD. Patients report long-lasting neurological, cognitive, and physical symptoms that can persist for months or years after taking the drug. Some of these people also develop intolerance to chemicals, developing reactions to fragrances, many cleaning products, medications, paint, air fresheners, cigarette smoke, and a lot of everyday environmental exposures and symptoms that closely resemble multiple chemical sensitivity. My guest today is Dr. Stefan Pieper, a physician with a 25-year career in integrative medicine focused on mitochondrial medicine. He's treated thousands of patients with fluoroquinolone-associated disability and written extensively about its biological mechanisms. Dr. Pieper's work raises important questions. Can medications trigger long-term multiple chemical sensitivity? What happens in the body when this occurs? What can be done to resolve it? And what might this teach us about the broader condition known as MCS? This conversation is part of a larger effort to understand on this podcast how chemical exposures, including prescription drugs, can lead to chronic multi-system illness. Thank you for listening to the Chemical Sensitivity Podcast. Please check out and share a link for the podcast's new webpage, listen.chemicalsensitivitypodcast.org. It's easy to share with anyone in your life who may be interested in learning more about MCS. Your doctor, employer, even family and friends. Listen.chemicalsensitivitypodcast.org. Please subscribe to the podcast wherever you get your podcasts. And to learn more, follow the podcast on YouTube, Facebook, X, Instagram, Blue Sky, and TikTok. And you can reach me at aaron@chemicalsensitivitypodcast.org. Thanks for listening. Dr. Pieper, thank you for joining me.
Thank you for having me.
For listeners, would you like to introduce yourself briefly, please?
Well, I'm a German doctor practicing in the little but very beautiful city of Constance in the south of Germany, near a big lake called Lake Constance as well. I'm having a practice, a general practice together with my wife. She's a doctor as well. And we are doing what we call integrative medicine. So we do a lot of conventional medicine, but this is recently only maybe a quarter of our time, and the rest is alternative and holistic medicine, functional medicine, as you say in America, trying to do for every patient to do a composition of different approaches, which we think is best to treat the patient, right? And we do that since 20, 30 years now, and over the last 7 to 10 years, I'm very much in this special area of fluoroquinolone toxicity. So at the moment, most of my patients I'm seeing are fluoroquinolone toxicity patients, more or less. Yeah.
Yeah. And we can use the acronym FQAD.
FQAD.
Do you want to help us understand in basic terminology, what is FQAD?
Well, We should start with the antibiotic, with a group of antibiotics. They are called fluoroquinolones. The most known one is ciprofloxacin, but there are plenty of others, and you see at the end of the words there's always the floxacin, it's levofloxacin, norfloxacin, ciprofloxacin, and so you can determine where if this antibiotic is one of these groups of this group of fluoroquinolone. And it's a very interesting group because in the 1980s it was the first antibiotic developed as a synthetic antibiotic. All the other antibiotics before, like penicillin and others, were actually a blueprint from nature. But the fluoroquinolones, they came up as a mistake during developing a malaria drug. And then they saw it's a very potent drug to treat bacteria. And then they developed this group of fluoroquinolones, which is really a very, very effective antibiotic group for bacterial infections. One has to say that. However, saying that, the last 40 years since this antibiotic group exists, millions of people have been treated with very minor infections with this potent and heavy drug, and because the huge scale of treatments, the huge number of patients produces a lot of side effects. The side effects are actually rare, 1 in 1,000, 1 of 10,000, but if you prescribe in a society like the American or here in Europe as well, millions of these drugs, then the number of patients getting ill are very high as well. So the estimation for a small country like Germany is 40,000 patients a year produced by fluoroquinolones, patients with this special disability. In America, it's 4 times higher, and it's about 320,000. Is a scientist called Bennett who did the count, who did the math about this. So, and the thing is that the clinical picture of this intoxication of fluoroquinolones is so severe that there is a special expression for this, and this is called Fluoroquinolone-Associated Disability. So that's what we are talking about tonight.
Thank you. And doctor, do some people who develop FQAD develop new sensitivities to chemicals? Could be fragrance, medications, or other environmental exposures?
Yeah, I see that a lot actually. I'm not sure if sometimes there is a disposition beforehand, and there is a manifestation of these mild symptoms maybe after intoxication, after having developing FQAD, but I see that a lot. There are actually 2 big groups of patients I can see. One group is very, very healthy beforehand. There are athletic, sportive patients, young, 20, 30, in their 40s maybe, doing lots of sports, very active, and then all of a sudden they get this Cipro or whatever drug, and from one day to the other they are bedbound and very, very ill. And another group, which is maybe a third of my patients, they are actually, you can see that the system was fragile even before taking fluoroquinolones. And some of them were sensitive beforehand. Some of them had a mild muscle activation syndrome or fatigue because of a virus disease or something else. And these patients, this group is very much at risk developing MCS after the fluoroquinolone intoxication. I see that very often, and I see as well that there are
Side symptoms,
which both groups can develop. For example, which is very often the case, is that my patient, the FQAD patients, develop mast cell activation.
Mast cell activation, right?
And I believe that MCS patients also have a very high risk of mast cell activation in the course of the disease. So this is one. Another one which I see very often is the leaky gut. If you have a look at the microbiome and the gut and do some gut tests, then there's a huge group of leaky gut patients within FQAD as well as MCAS and MCS patients. And this is something which makes the picture a little bit rounder, because I think is my belief I don't know if there is any scientific evidence for that yet, but that the leaky gut is probably one of the very early illnesses or very early symptoms which leads to other more serious illnesses afterwards, like, for example, MCS. So, yeah.
What I heard you say is that many people who take these antibiotics develop MCS. So is FQAD and MCS the same illness, or do they share similar? Are they similar in some ways? Can you help me untangle this?
Yes, I think they are similar in some ways. They are two different entities, two different illnesses, of course. There's a lot of similarities. Like, for example, I could start with the energetic problem both groups have, like fatigue syndromes, which is very, very severe often in FQAD. Lots of patients with FQAD have developed an CFS, a chronic fatigue syndrome, after being ill for a longer time then. And MCS patients, I see that they have fatigue problems as well, energetic problems. Probably both groups, the reason for both in both groups is the mitochondrial damage, I would think. At least in the FQAD group, the mitochondrial damage is very, very severe, because the fluoroquinolone, the antibiotic, aims to destroy bacteria with the aim to destroy the genetic part of the bacteria, the DNA, right? And the mitochondria, they have got the same DNA like a bacteria, and the activity of the antibiotic drug goes as well in the mitochondrial area than to the as in the bacterial one. This is very, very dangerous as well for the human cell as well as the bacterial cell. So, and that's because that's the reason for the for the mitochondrial damage with a lot of free radicals going around in the mitochondria, and so they are destroyed, and then but they are not, it's not a clean cell death. They don't go into apoptosis within, I don't know, a day or so. No, they survive this damaged mitochondrials, and they survive as cell particles, which produces lots of free radicals, which worsens the situation within the cell. That's the problem.
I think this research is really critical. I'm sorry to step on your toes.
Yeah.
Another guest talked about the mitochondrial damage and actually talked about MCS as a mitochondrial illness. And to me, that's just revolutionary thinking and so important. Because so often we're told, as you know, that it's in our heads, it's a psychological disorder. But if we think of it in concrete terms, that's actually, for some people, caused by cellular damage.
Exactly. Yeah. That's the problem always with these more or less unknown diseases, that that the risk to give it a psychological name or a psychiatric name is very high. Yeah, in our medical society, in the medical group I'm in, the doctors, for example, I see that every day. Yeah.
You see that every day among your fellow physicians.
I see that every day. More than 90% of my patients come from an environment where they were stamped as psychiatric patients, or at least with a psychological damage.
They were diagnosed with psychological disorder.
That's
and in
it,
fact, they had mitochondrial or cellular damage caused by, as a result, often of taking antibiotics.
Yeah, it's an organic biochemical disease, actually. Yeah.
And the patients who come to you must be so relieved to find you.
Yeah, I mean, the publicity for FQAD is, at least in Germany, higher than it was, and it used to be than it was 10 years ago or 15 years ago. Nobody knew this term, and nobody really cared about drug-related diseases at all. So but now it's a little bit more common to think about this problem within the doctor group as well, and the patients are a little bit more sensitized to think about this. I think it's in America. It's the same. There is more knowledge around. You can ask the AE, or you can ask Google, and you find your way to the doctor who knows a little bit about that, which wasn't possible 10 years ago.
And many of the people who come to see you are experiencing chronic reactions to chemicals and environmental triggers, including fragrance. How do they get on? How do they cope? What are their day-to-day challenges like?
Well, it's very different. I have lots of patients with suicidal thoughts to start with when they come to me. One reason is that unfortunately the fluoroquinolones disturb the neurological system called GABA. The GABA system in the brain is a system which calms you down, which always tells you take it easy and sleep well, and it's nothing to worry about. And if the GABA system is blocked from this fluoroquinolones molecules, then the patients become anxious and over-agitated and nervous and sometimes really psychotic, or overwhelmed and with a suicidal tendency. That means that most of my patients and most of the patients with FQAD I know, they die of suicide. Nothing. I mean, sometimes there are other reasons, but they are very rare. The most common reason for fluoroquinolone to die on is suicide.
It's devastating to hear that. And we know
Yeah.
that it
Yeah.
happens a lot with people with MCS for many reasons. And part of it is the lack of medical recognition and the gaslighting, rejection, misdiagnosing we face in the clinical encounter. Also, the social isolation.
Yeah. The stigmatization. This is the ignorance of the system, which is sometimes the worst part of the illness for many patients.
It's very difficult, and it can lead to despair. And I wonder, Doctor, are there things that people can do who have FQAD or chemical intolerance to, other than avoid and survive? Are there things that people can do to restore their health?
Sure, there are many. I mean, when I first started with these problems, the treatment was very limited. I have to agree, but now after many years of treatment and many years of help from a huge group of patients, and they all of them try different approaches, and so I learn a lot from my patients as well. There are very different ways to treat FQAD patients now, right? You can do it with nutritions. You can do it with different diets. You can do it with different minerals or vitamins, like orthomolecular approach. You can sometimes even use medicaments. This is more the rare side of treatment, but even that you can use. You can do
Prescription medication in rare
prescription
instances.
medication, or you can use, which I use a lot at the moment, is the low-dose naltrexone approach,
Yes.
which is very, very interesting. An approach which comes from America and is now a very a good part of my treatment protocol.
LDN, low dose naltrexone. Yeah.
LDN.
And
Yeah.
yeah. And there can be some side effects with LDN as well,
Yeah.
if I'm not mistaken, right? So
Yeah.
is it a medication that needs to be taken with caution?
With caution, of course. But I have to say, every even a vitamin or mineral has to be taken with caution, because the fact is that the patients are sometimes so sensitive to everything that you have to think really about what you should give and what you should avoid. I always say every patient to avoid all this actionism. Even so, a doctor or somebody who wants to help gives an advice which is well meant, but for example, detoxification in an FQAD patient could be a disaster for him, right? To start detoxification, because the system is so fragile that that everything would the rest of the building would collapse, you know.
Dr. Pieper, what does FQAD tell you about the harms of chemicals in the environment, fragrance? Does it teach us anything about the nature of these products that are often underregulated and found in daily life?
Well, it teaches me, of course, but and it should teach everyone really that our environment it's much more dangerous as it used to be in the last century, for example. But so we have to take care for ourselves. We have to think about every step we take in the medical sense of step. We have to, as persons, we have to think about the advice that doctors gives us, and if we go for it, or if we leave it, if we ask our gut feeling, is it good to do that? And on the other hand, I see so many chemicals which are ignored. Take, for example, this issue of forever chemicals, which is a huge issue, but nobody really cares about that. And there are so many different effects um, which can harm our cells and our mitochondrial function. And then comes along a fluoroquinolone drug, which gives you a really a complicated clinical picture, and then there is, if you are unfortunate, then the rest of your life is going to be changed. And yeah,
It really does. It really does. And many listeners live that and know that very well personally, and as I do myself. I want to ask a couple more questions before we wrap up our conversation. But before I go to that place, when I think of mitochondrial function and illness, a previous guest talked about the mitochondria being like the battery reserves in the cell. How could you help me understand what mitochondria is in simple terms?
yeah, all right, okay, I understand. Well, I mean, the mitochondria is a part of the cell which is usually called the power plant. That's the part of the cell where the energy is produced for the cell, and it's actually from the chemical point of view, it's like a fusion plant. It's a very smart way to produce energy. But on the other hand, the mitochondria are very, very fragile, because there are lots of chemicals around which can also damage the function of a mitochondria. And this is imminent. This is in this system, and we are talking about the free radicals. And free radicals are on one hand very, very important for the function of mitochondria, but the cell has to get rid of this free radicals very in a very proper way, to not have the damage they can produce. And so there is how you call it, a vicious circle, really. If the damage to the mitochondria once starts, then the body sometimes is not able to repair this damage, because for the repairment of this damage, the cell needs energy. And that's exactly what the cell doesn't have anymore, because the mitochondrial, the power plant, is damaged. So this is one of different, a main reason for having a chronic disease in the end, right? Because
Understood.
the cell is not able to heal itself, really. So you have to give lots of help within the system, like antioxidative remedies and so forth, to help the cell to recover from this
And I think a
damage.
lot of people who are listening maybe don't have access to a specialist like yourself yourself, and maybe even don't have access to any doctor at all. And when they do, they're often don't get the reception that they want, or can even be very harmful. I know you can't see every person with MCS or FQAD, but are there any practical steps that you might be able to offer to people?
Well, for once, a very, very important approach is to change the diet and to change the way of living, to live under circumstances which are a lot more easier and a lot more lower on a lower level.
Of toxicity, I imagine you mean.
Yeah, exactly.
Less exposures, eliminate the exposures. And we
Yeah.
start with making our home as safe as possible.
Exactly. And then there is this huge word empowerment, and that everybody should try and think and take the opportunity to think for himself, rather than listen to others and listen to doctors and listen to, I don't know, Dr. Google or so, and to see what is best for me, what does my gut feeling says about that.
Yeah.
And
And
this
when
is
it
very
comes to,
important, I
it's
think.
very important. And people have a lot of knowledge, self-knowledge, don't we?
Exactly. Yeah, that's what I mean. Yeah, but they don't realize that, or they ignore that, rather than take it in and yeah, that's the problem. I hear it every day when somebody says, "Yeah, I had to take this antibiotic because my doctor told me so." And nobody should tell you what to do in a situation where it's you taking this drug and not
Yeah.
any other person. Yeah.
We're often put our trust in the clinician. It can often happen in times when we may not be able to make sound judgment or have clear thinking. For example, it could happen in an emergency situation. It could happen in surgery. It could happen in a case of serious illness. And when we desperately need help, and again, we put our trust in medical care providers.
Yeah, exactly. So it's always easier to do that, of course. Yeah, to give that in the hand of others, and you think they know more than myself. But in the end, it's always for the patient to decide. This is the most important thing I have learned. Yeah.
Yeah. And perhaps lastly, do you see that there could be positive change, that clinicians and more physicians like yourself and more researchers will have an understanding of drug-induced chemical injury and the dangers of many prescription medications?
Well, I'm not so sure. I would like to be optimistic, but to be honest, the whole picture of how to do medicine became a lot more mechanical, right? And a lot more a one-way picture, and that's very dangerous, I think, because we have to take everything into account, and one of the biggest problem is that, as you said, that this multi-toxic environment which we are staying in, with lots of different even medications from different doctors and so on, can destroy our cell systems. The doctors have to see where we go and where this system doesn't lead nowhere. So, but at the moment, I don't see actually that there is an improvement regarding this problem in the the doctors' society, in the medical society. I think that's a huge problem because the risk is rising. The risk for these kinds of illnesses is going up instead of down. So we have to take that into account as doctors, as therapists. Yeah, that's really important.
Would you like to add anything else, Dr. Pieper?
Well, as far as I'm concerned, I think it is very, very, as I said before, the empowerment of the patient is the most important thing. With the intuition, with the own gut feeling, everybody can handle his own problem in the best way. I think this is really a very, very useful tool for everybody.
Mm-hmm. You've been listening to the Chemical Sensitivity Podcast. I'm the host and podcast creator, Aaron Goodman. The Chemical Sensitivity Podcast is by and for the MCS community. The podcast is generously supported by the Marilyn Rockman Hoffman Foundation and listeners like you. If you wish to support the podcast, please visit chemicalsensitivitypodcast.org. Your support will help us continue making the podcast available and creating greater awareness about MCS. Please check out and share a link for the podcast's new webpage, listen.chemicalsensitivitypodcast.org. And to find out more about the podcast, follow the podcast on YouTube, Facebook, Instagram, Blue Sky, and TikTok. And you can reach me at aaron@chemicalsensitivitypodcast.org. Thanks for listening. The Chemical Sensitivity Podcast and its associated website are the work of Aaron Goodman, made possible with funds from the Marilyn Rockman Hoffman Foundation, supporting efforts to educate and inform physicians, scientists, and the public about multiple chemical sensitivity. The content, opinions, findings, statements, and recommendations expressed in this Chemical Sensitivity Podcast and associated website do not necessarily reflect the views and opinions of its sponsors.